We have constituted this meeting for the purpose of co-designing a brand new application that is hopefully going to improve the communication between doctors and patients, between healthcare workers and patients, but even between caregivers and patients with type 2 diabetes.
Why is diabetes an issue? It's not just because it's high sugar, but what does that do to a patient or a person?
So this app, what it's going to do is going to create a story. It's going to take your personal details in terms of your demographic information, where you live, the community that you're in, and then it's going to create this story for you to help you understand what is type 2 diabetes, what can I do in terms of diet, what can I do in terms of exercise, what does it mean in terms of management, how do I explain this to my child, how do I explain this to my parent. And so what we are trying to get to is another mechanism that can assist people with understanding their diagnosis and how to manage it.
We've been working to generate stories for diabetes patients, and today we're reviewing the first versions of the stories. There are lots and lots of challenges that came up.
We have stories in our heads, but we don't have the right words to speak to one another about the challenges of diabetes, but also what is the opportunities that you can live with the disease further than the diagnosis. So I hope that this would give them vocabulary, but also a medium to actually bridge the misunderstanding between the patient and the healthcare provider.
What I found most useful was, one, that we were able to get diverse perspectives from people. We were able to get the voices and the needs and the wants of society, of people, everyday people who are walking on our streets, in terms of what they would want for a health story if they were type 2 diabetic.
I came to this workshop mainly to investigate what do the patients, what do the health experts think these health stories should look like, what should be the purpose of these stories, and how much more work needs to be done to kind of improve the outcomes that we want to have.
It's a really, really insightful event and really exciting. I think it shows us both the opportunities that we have to think about how we can personalize stories and really make information bite-sized, but it also shows us some of the challenges, because how do you make sure you really get that context which is necessary?
Inspire the